Hello, doctors. It's Alan here. Today we're going to talk about mainly about the MCQ exam and also about possibility of getting jobs in Australia here. Also, I've got about 4 other doctors that are going to come in and talk, that are doctors that have done our courses and that have gone on to either specialise or one of them is actually owns a business called the Australian Home Doctors Service, which he employs something like well over 100 doctors. And so some of these doctors are coming in to give you some advice about anything that you might want to about getting a job and to know about getting a job. And also I've got another doctor that's going to be coming in and just giving a little bit of a discussion on how we teach in our MCQ course. So I'm Alan. So I wanted to warn you that these doctors that are coming in I've told them that we'll be doing this seminar from 2 o'clock till whenever it finishes. So as soon as they're available because they're all pretty busy, just let me know when they're there. Once they're there, they'll advise me that they've come into the meeting, and then I'll stop, and then they'll do their little part of their session, and then Dr. Naraj is already there. So, and then I'll continue on from then. So I think if you're already there, Dr. Naraj, do you want to, you could start off by talking to them and just tell them a little bit about your journey and what you're doing, and then I'll take over from where you leave. Okay?
Sure. No worries. Thank you, Alan. Thank you, ARIMGSAS team, and welcome everyone for this quite great concept that Alan has started, I think, to keep in the loop and informing about the jobs, which is what everyone would like to have as the desired outcome of your journey. So obviously I've been with Alan and known him for 12, 14 years now, Alan. When I joined you, obviously, and I was one of you when I was doing the exams and all bits and pieces. So the journey obviously is quite interesting and adventurous as well as rewarding. So I did my exams 12, 13 years ago, obviously with Alan, and came through all the way, and I'm practicing GP at the moment with running this national after-hours home visiting service, and we currently employ close to 200 doctors with our team. So we are now one of the largest in the industry sector in Australia, and operating in 5 states, excluding WA and Darwin at this stage, Northern Territory. Look, getting job, obviously, it's not about getting the job. I think if I have to share my experience and a bit of tip of advice, exams are easy. You just have to do it. As long as you follow the instructions, you follow the pattern, and the way ARIMGSAS has set this all up, you will crack it. There's no issues with the exams. The journey starts as soon as you finish your exams and get to the mainstream to try to find a job. Now, getting a job is competitive, as you know, and it could be quite exhaustive and frustrating at times. What really important is that how you are approaching, what is your attitude towards the work. You need to be open for any opportunity that comes anywhere in Australia. Getting your first foot in is the most challenging part. Once you are registered with APRA and you have done a 1 year of term anywhere, then you would have a better chance to move at your place of choice. But do not put yourself in a predicament situation where you are putting some conditions on where you can work, what type of work. Just be open to the opportunity. Get your foot in, get registered with APRA, and then start your journey. This is probably the best advice. When I did my exams and I was looking for a job, I really don't had any preferences for any city, any country, any state. I just put the bag on my back, and I was traveling from state to state, suburb to suburb, town to town, and knocking the doors to the hospitals, meeting the medical superintendents there, and sharing my resumes. I had about 200, 500 copies of resume in my bag and just traveling everywhere. And luckily, one of them got me the observation unpaid for 1 month. That was the opportunity you should be looking for to get your first foot in, where there's a paid, unpaid observership. Once you get the observership in, that's the time for you to blossom, to show them that you have the capability and competency to deliver whatever the requirements of the job are. But also, more important is to demonstrate your ability as a team player, how good you are in taking the feedbacks and criticism on board, how good you are in taking extra work and extra load on board, how good you are with your colleagues, with your peers, what's your communication strength are with the patients as well as the colleagues. So these are all things that can get observed very closely at your workplace, which you don't even realize that you are getting observed all the time there. And this becomes a very important part of your extension or a job offer. So after the second week, I was offered the job and I took it. That was 2 states away from where I was living. Family was away, didn't matter. I just went there, stayed there for 6 months, and then got another job offer from a hospital of my town, which was a tertiary hospital, so in Brisbane. That was obviously the journey. So my piece of advice to every one of you would be to have that flexibility available, be ready to take up the opportunity and observe. If you have any opportunity to be part of a consultation in a GP clinic, in a hospital, or with anyone, just absorb as much as you can how the actual conversation happens. And that's part of your part 2 of clinical exams anyway. It is not about the depth of clinical knowledge. It is more about how do you approach a situation, whether it is a clinical consultation environment, whether it is a peer-to-peer conversation, talking to the specialist for referring a potential patient, talking to the pathology, radiology, discussing the situation with the family or even with the patient. So this is all becomes a very comprehensive part of the medical jobs that we all do. Now, remember, we all have come through different backgrounds, different medical systems, but we all have to learn and understand how Australia works. What is the Australian culture? You need to learn few things and try to develop interest in things like sports. You need to be on footy. You need to be on the rugby. This will help you to get engaged in the conversation at your workplace, and also to interact more openly. So these are the few things that you certainly work on while you are doing your exams. This probably I found quite helpful when I started, and certainly it makes a big difference. Now I can talk whole day about anything related to an IMG, being part of that myself and helping others IMG to get into the job, get into their first job, and also ongoing mentoring and supervision for many as we speak today. So we were very well adapted to the challenges that comes, but it is all doable. It is not hard. All it needs is the persistence and your commitment to the society and community, which is very important. If you have any particular question, feel free to jump in or put your questions in the chat box. We're more than happy to take it. If anyone would like to discuss any job opportunities or what are the requirements or how can you get into job with us in the GP world, feel free to get in contact with Kush or the office of Ellen, and then they can forward on and get us connected. That's probably is about us. Any questions from anyone?
Kush, any questions from to Dr. Naraj from the chat box? I'm not sure whether she's there.
Here, yes, Alan.
Yeah, any questions for Dr. Naraj from the chat box?
Yes, so I think reception is calling me. How difficult is it to get to a specialist program?
Yes, Pratik, not at all. Short answer is the only difficult thing is to get your first registration with APRA, and the second step is to get your general registration. Once you have got your general registration in place, it is open. And I can assure you that at least in Australia, you can dream of any branch you like to do the specialty in, you will get it. All it will take is your time and your commitment towards that particular specialty. Make sure you do your homework. For example, if somebody wants to do in radiology, first thing for any specialty, get your first registration, conditional or provisional registration, do your rotations, get your general registration. Once it is done, and while doing this, make sure you associate yourself with the relevant specialty by volunteering yourself in participating any papers, posters, or any research that anyone else in that particular hospital or practice is doing. Make sure you join their CMEs, their conferences. All you have to do is build your CV and demonstrate your genuine commitment to particular specialty, and then keep pursuing that particular department and the unit heads in that hospital. How can you get onto your house officer jobs in that specialty? Once you're foot in, you are on. So believe me, if you dream of any specialty, you can do it. At least in Australia. I know in America it's a bit hard to get in certain specialties, or in other countries, but in Australia, 100% I can assure you, you will get it.
Dr. Naraj, I've got a doctor that's coming in after you. Was in our MCQ course. Now he's just finished his surgery. He's working as a surgeon now. So he's going to explain to the people about their specialist pathway too. Yeah.
Perfect. Great. Okay.
Yes. Unmute yourself, Kush.
We had another question that how much time would it need to prepare fully, that I can answer for AMC. But for Dr. Naraj, I guess they're asking, is there any prior experience needed to get the first job?
Look, it certainly can help in certain way. For example, if you have an experience in emergency, just put it this way. The first job that you're going to get is only two points. One, in a hospital as a junior doctor, which is equivalent to PGY1 or an intern. And the second one is an area of need for any general practice. Both of these will give some weightage to your prior experience. If you have experience in emergency, pediatrics, general surgery, which are always helpful in these particular two fields. But to be honest, not that much, unless you are applying for an assessment through the Royal College of General Practitioners for your previous experience. If you have worked in a community medicine or a similar field of general practice overseas, that could definitely play a role. But for the hospital job, it will make your resume look good. But at the end of the day, it is your interview and the selection process of the hospital.
I think that's all, Dr. Naraj. Nothing after that. One of them asked if he can record, and I've said yes to him. He's saying thank you.
Great, no worries. You're most welcome.
Thank you, Dr. Naraj.
Thank you, Dr. Naraj.
It's a pleasure to have you on board.
All right. Thank you very much for coming in.
Great. Thank you. And Ellen, keep doing what you're doing. You are the godfather for all IMG. So I thank you from my bottom of heart always.
Thank you.
Thank you.
Dr. Naraj. Thank you.
Thank you.
Bye for now.
So I'll continue on now with until the next doctor that's going to talk, he'll come into the session. So just to let you know a little bit about my background, I've been doing this for a long time, running courses for overseas doctors. But also, for those that don't know, I also lectured at Melbourne University in the Faculty of Medicine, mainly working with overseas or IMGs that are doing medicine And I used to work with mainly 5th and 6th year medical students, and the work I did was work on the wards. I do lectures to the full cohort of students, but mainly working on the wards at the Royal Melbourne and at St Vincent's and at the Austin Hospital. And usually I would work with a consultant, and we would do the ward rounds, and I would talk about the clinician would talk about the different medical aspects that, or whatever, when I was seeing the patient, and I would deal with all of the other things like, you know, the communication, the body language, the emotional intelligence, all of those sort of things in when someone's dealing with patients. So I've got experience of both, mainly dealing with the overseas doctors and their preparation and their journeys, and but also with the local medical students as well. So at ARIMGSAS, we would have thousands of doctors now that are working. Many of them have gone on to be fellows in general practice. Many have gone on to specialise, and even I think I've got 5 or 6 that have gone on to be full-on professors. So like what Dr. Naraj was saying, virtually once you get into the system and you become fully registered, you're like the same as any other doctor in Australian system. The opportunities to either get into the training programs and to specialise will be the same as you, the same for you as what it is for any local medical student. And it'll often depend on what your performance is like in the hospital, because to get into any of the colleges, like in paediatrics, surgery or whatever, you'll probably need some sort of support from either professors or consultants in the hospital, because it's quite competitive, these specializations, but you'll need some sort of support to get you admitted into those specializations, but it can be done. And generally, often people say to me, what's the secret about getting through these exams? And I think what I would say is the main secret is hard work. Like, you put in the work and you'll get through. If you do the courses at ARIMGSAS, we'll give you the guidance, but you still need to put in the work, but we'll guide you. So, and our pass rate, well, this seminar is mainly about the MCQ course. So our pass rate is excellent. If you decide to sit the MCQ exam with the Australian Medical Council, generally the pass rate fluctuates between 45 to 50% for the MCQ exam. People who do our course, the pass rate is at least 95% that pass the exam. So this MCQ exam is probably the most, and I don't know, all of you people that are there, some might be looking to sit the MCQ, some might have passed it, some might be preparing for the clinical. I'm not sure who, but I know that you've registered for this workshop. But the MCQ exam is probably the most important exam that you're going to be sitting, because in Australia now, you can't work unless you've passed the MCQ and you've got a current English assessment. Once you've got that, and you've got that out of the way, you can usually say, look, I know that I'm going to be working as a doctor in Australia. And the situation now, since COVID, is as good as I've ever known it. And I've been involved for a long time, more than 40 years for the overseas doctors. The situation for employment is good now as ever I've known it. We run short courses for the clinical here for 7-day preparation for people who are just about to sit the exam. In all of those courses now, nearly every doctor in those courses they're working. And they've only got MCQ, and they've got English, and they've picked up a job at a hospital, some in general practice, but mainly in hospital, with just the MCQ exam. So the advantage of doing a course is that not only that it'll help you prepare for the exam, but it's something that you can add into your CV that you've done the course. And you can put some details about what you're doing in the course, because our courses are very well known right across Australia in all the hospitals. And it can be a big advantage. And I can tell you, if you go for an interview at a hospital job and you're someone that's done the course, and you're against someone that hasn't done the course, you'll get the job. Because all hospitals now know what the standard of our courses are, what the preparation's like, and the reputation that we've got. So there are some basic things that you need to do to be able to get a job here. One is to pass the MCQ. Secondly, to have a current English assessment. But then there are other things too, which you can get if you've done the course, like you'll need to have some referees from Australia. So number one, you could, if you've done a course with us, and not just a workshop or whatever, it needs to be a course that like goes for at least minimum, I would say, 6 weeks. And once you've done that course, then I'd be happy to be a referee for those people that have done our course, and that they can put my name into the CV. But there might be some other doctors that are tutoring that are working, and you might think that they're impressed with you, that you could ask them, maybe they could be a referee. So if you want a job here, you do need some referees from Australia if you want to work in Australia. I can give you an example of that. Like I had a hospital ring me about a doctor, and this was in a hospital in country Victoria called Wodonga. And the doctor that rang me, he was ringing me about a particular doctor, and then he said, look, we noticed your name in a lot of CVs. I said, oh, that's because I do these bridging courses. And he said, oh, there's one doctor here and all her referees are from Peru, and we noticed she's done your course. And then I said, oh, who's that? And they told me her name, and I said, look, she's good, because I knew who it was, because I don't get that many doctors from Peru. But my point, they weren't going to interview her because all her referees were from Peru. So my point there is that you need if you're wanting a job here, you need to have a referee from here. So the thing is, they won't, if all the referees are from a particular country, like it could be anywhere, it could be Egypt, it could be Poland, could be anywhere. And if all the referees from there, they won't contact them because, first of all, they're not sure whether they can, how good fluent they are in English for a start, and they're not sure how unbiased the referee report will be if they're all from the same country like that. So when you're putting this CV together, you definitely need one from your country of origin. If you don't put that one in there, the first thing that people think when they're reading your CV is that, oh, I can see this person's from Malaysia, but they haven't got a referee from Malaysia. There must have been a problem with that person in Malaysia. So you need at least one referee from your country of origin, so that you're telling the people that are reading your CV, look, if you want to ask them about me, there, I've given you the details, there it is. You can contact them if you want to. But ideally, I would say that you need one referee from your country and 3 referees from here. And most people will say, how do I get referees from here? Because I haven't worked here. But you're not unusual. You're the same as any other overseas doctor that is looking for a job in Australia. And I'm telling you, these are the requirements that you need if you want a job. Okay, so from my experiences, many of the overseas doctors might be, they might be from India, for example, and they might have 1 or 2 referees from India, then another 2 from Australia. And those 2 might be just people that they know, that they might have known from when they were in India, but they're now working in Australia. In Australia, the overseas doctors take up at least 30% of the medical workforce in Australia. So it's huge. It's huge. So there wouldn't be that many overseas doctors that are looking to come to Australia that wouldn't know some doctors that are already working from their culture in Australia. So then you just have to, these are not, extraordinary things I'm asking you to do. These are basic requirements. Another one is that you have a good CV. And a CV means if your CV is not up to a really good standard, then you won't get anywhere. And I see that. Even I see people that have passed their clinical, and they'll come and see me and they'll say, Alan, I'm really struggling to get a job. And then I say, the first thing I'll ask them, show me your CV. So then they show me their CV, and you wouldn't believe some of the CVs I see. And of course, they're not going to get a job. So a CV is like your business card. When you send it, it needs to, and people get caught up a bit by saying, you know, oh, how much do I put into the CV? And my experience with doctors is that you put as much as possible about yourself and what you've been doing, about your job, into your CV. What works best for doctors is the more information you put about yourself in your CV, the better. So again, if you do our courses, we have someone that can help you with your CVs if you're not sure. I mean, it's something you can do yourself, but if you need guidance, you get that sort of guidance if you're doing a course with us. So with our courses, you're getting preparation for your exam. You can put the course that you're doing into your CV. You can get advice about where to apply for jobs. You can get advice about what your CV should be, how it should look, what sort of things need to go into the CV. And it goes, and if any of you know anyone that's been through our courses, we know we treat the people that do our courses like part of our family. So if you start with us, the only time that and you finish the course, we say, no, that's you finished the course. We're not that interested in what you're doing now. We are really interested. We want to be there right until the time you start work. So that might be that you decide to go on and do a clinical course. It might be that you decide that you just want to start putting all your emphasis into the getting a job, because each person's situation is very much individual. Okay, it depends on a lot of things, you know, what your financial situation is like, what, you know, just many factors about which direction you want to take. Of course, it's better that you do the clinical first, but you don't need to, particularly in these times. You can pick up a job, but at some stage you'll need to do the clinical. Usually what happens, if someone picks up a job with just their MCQ and their English, then the first job that they start with, they'll start with what they either call temporary registration or limited registration. And you'll stay on that registration until you do two other things. That is, work for 12 months in a hospital or a clinic, and then also pass the clinical exam. If for example, say you get a job after passing MCQ and you've got your English, you work for 12 months in the hospital, and then you decide to sit the clinical exam, and you pass the clinical exam, and you've worked for 12 or 14 months in the hospital, that work that you've done is counted retrospectively. So that person, once they pass their clinical exam and they've worked for 12 to 14 months, then they will get full registration immediately on passing the clinical exam. With the limited registration and that you usually have got 3 years with temporary registration or limited registration to pass the clinical exam. So you can work, and then you've got to decide sometime within that 3 years to sit and pass the clinical exam. My only advice there, and I see some situations where people start working with their MCQ and they're busy and they're working and they're earning good money, and often they get themselves established and they think, oh yes, I'll sit the clinical exam, or if you're working as a GP, I'll sit the fellowship exams and I'll pass that, which if you pass that means you don't have to do the clinical exam. But they leave it to the last minute and then they sit the clinical exam maybe after 2.5, 3 years, and they might fail. And then all sorts of other pressures come in, because when they're getting up around the 3-year mark, APRA will start, the registration body will start to hassle you. Why haven't you passed your clinical exam? And they then, in some exceptional circumstances, they might give an extension for 6 months or maximum 12 months, but they will still be on your case about you passing the clinical exam. And they'll be threatening you with deregistration, which, believe me, it happens. If you haven't passed, if you've been working for 3 or 4 years and you haven't passed the clinical, then for sure APRA will be giving you a hard time about getting registration. And I've had some people that have got deregistered. Then it means you just have to wait till you pass the clinical, then you have to apply for registration again. So why I'm mentioning that is that if it happens that you do pick up a job with just your MCQ and your English, make sure you started thinking about getting the clinical out of the way early rather than later.
Alan, there are a few questions being asked. Would you like to answer them now?
I think I can see Nikhil's there.
Yes, he's here as well.
Let Nikhil hang around.
Okay. Hi, Nikhil.
Dr. Nikhil,
Hi,
he
Kush.
finished our MCQ course. I've asked him to come in and talk to you just a little bit about how we teach in clusters in our course. And Kush was telling me that some people are asking questions about how does that teaching go with clusters. So I've asked Dr. Nikhil to come in and explain how we actually teach in the MCQ course, and he's kindly agreed to do that. So I think I'll pass over to Dr. Nikhil, and he can explain to you how we teach in the MCQ course, and then when he's finished, I'll continue on from there. Is that all right, Kush?
Yes, Alan.
All right, Nikhil, it's over to you.
Thank you, Karen. Thank you, Omar.
Hi, Nikhil.
So, yeah, I'm Dr. Nikhil, one of the tutors in the MCQ. So, how teaching happens in Allen Roberts is, I can give you that many people take like 6 months or a year or 2 years to crack this exam if they're studying by themselves. And it's a very vast content out there because you don't know what's being asked. But in Allen Roberts, what they do for the students is they cut short everything, and you get a focused subject of what is being asked in the AMC MCQ exam. And we teach here in clusters. So, for example, if you take general medicine topics, will be taught in nephrology, respi, rheumatology, endocrine, thyroid. So each day, not a single day, but like for example, cardiology might take 2 to 3 days. So ample amount of time is given for individual modules, and you'll be taught subject wise with people who have been like you'll be organized different days. And I think you'll also be having a ECG workshop in the course, and you'll be given CPD points for that as well. And yeah, you'll be having obstetrics and gynecology and all the topics which are being asked in the exam with active like latest recalls being picked up and being asked in the class. And you'll also be given a chance to answer the questions after the topics have been taught. And your way of thinking will be kind of modulated towards how to answer the exam questions rather than how to answer the clinical scenario, because this is more of intern related person who's coming into Australia. It is the exam directed towards that person. So I know few of you might be specialists back in the country. So looking at a question, you might think that the answer might be something very complex, but you need to think in a very simple manner. And that's what the tutors push you towards answering in the questions. If anyone is having any specific questions on how the course goes on, I'm happy to answer specifically.
We had a question where they were asking that, can I give my AMC clinical from India? And I guess that's a yes to that.
Yes, now
Because
it's online. Manoj is asking how long is the course. So Manoj, the course will be for 6 weeks and you'll be given a few off days in between to study as well. So yeah, and the timing of the course will be 9 a.m. Australian time to 5 p.m. Australian time with 1 hour of lunch break in between.
And Nikhil, there's a 12-week MCQ course too, which runs 2 hours on a Monday, Wednesday, and Friday night, and then 5 hours on the weekend. And that goes for 12 weeks. Yeah.
How about I'll elaborate about the courses at the end and explain everything about our courses. What's the duration? What are the options? If they're working, what all they can do. I'll do that. I'll sum up all of that at the end. Yes? Is it okay, Alan?
Yes, Kush, they're good.
Okay. Thank you.
Yes, the classes are not recorded, Dr. Abnaya. You have to listen to the classes in like when they're going on.
You'll get one free repeat for which if you think yet that you've missed something in that 1 6-week course, you can attend that missed portion in the next 6 weeks.
And you get all the tutor slides as well, so that they'll be uploaded in the portal, and then people can, so if you happen to miss a tutorial, you would be able to check with the tutor slides what sort of things you've missed.
There's no difference in the online and offline course. Both of the courses are pretty much the same. Nikhil, would you like to answer that?
Yeah, so online and offline. So people who are down in Melbourne, I would suggest you come down to the center because Alan gives us a very good space to study, and it's a very good classroom environment so that you can come sit down. Most of the tutors try to come in person. So you can even talk to the tutor about how you're going about studying, and you have any queries, you can talk to them. And apart from that, there's not much difference for online or offline MCQ when you're attending this course.
Okay, thank you, Nikhil.
Thanks, Alan. So, Kush, was this question for clinical or MCQ?
Mainly MCQ.
I'll have a look about the 12 weeks. Yeah.
Okay.
I'll answer that, Nikhil. All
Yeah.
right. In regards to the online and face-to-face, I wanted to mention as well, because the whole pattern is going to change online, and we get our start tutors online. Basically, 70 to 80% of the portion would be covered online. It's really beneficial if you're sitting across the world in all the parts of any part of the world, to have an online access. We are trying to change it all towards online because it's going a bit towards online. So 70 to 80% of it is online. There's no difference. They're completely interactive classes. For us, it's always the feedback from the students. Every hour, every break, we can, for us, it's word to mouth. If the candidates are happy, we are happy. That's the feedback. If they're not happy by the end of the day, we try to sort all of that out as well. So we've been running all these courses back throughout the year. So now we've changed it a lot to online, and we've got a very good pass rate, more than 96%. So there's no difference in online and face-to-face. A lot of content is online only. So the 12 weeks as well after hours is just online. There's nothing face-to-face for the 12 weeks after our course.
Kush and Nikhil, I've got Dr. Nagendra there, who's just arrived. So Dr. Nagendra, can you unmute yourself? So Dr. Nagendra, for those that are asking about specialist pathway, Dr. Nagendra did our MCQ course many years ago, and now he's just finished his fellowship in surgery. So I've asked Dr. Nagendra to come and talk about his journey. So if you would do that, because I'm a bit worried about it, because Dr. Nagendra is traveling today. So he's kindly come in and decided to just do a little bit of a presentation for us before he travels. So I'd like to introduce Dr. Nagendra, and it's great to see you again, Nagendra.
Yeah, great to see you again, Alan. Thanks a lot for this opportunity. I intentionally like to do that because I think often all of us who have come up from also all corners of the world come in to Australia with lots of apprehensions and anxiety. And I think my job has always been, when I was tutoring in the institute also, is to allay that anxiety and these apprehensions. I think I'm a good example of it. And there are many hundreds of examples of I wouldn't call IMGs, but all the graduates who have come from other countries who've actually gone on to these paths and become doctors and working in various hospitals in the country. I started my journey with Alan, I think in 2011, I think back in 2011, when I did the course in Melbourne, in the tiny shed next to the Flagstaff. In the winter, in the cool winters, when we were like, the ACs were not working that time, but it was all fun. So it was great course. I think the course really helped me in one sense. I'm sure lots of graduates who've come in would have done some residency years back home from wherever they are. So often when you're crossed to be a bit more senior, this exam can be a bit difficult because you have to zone back and go back to your basic levels. I think for me to crack this exam, it was difficult because I think I was very bad at MCQs to start with. And then I was already a few years down the line. So go back to reading pediatrics, psychiatry, and keeping it simple was difficult for me. I couldn't crack the exams a few times. So I came to the course. I moved from Perth to Melbourne, stayed here for 1 month in Melbourne, and I did the course. And I think the key principle of the course, I'm sure all the tutors would be saying, but what worked for me was to keep it really simple, stupid. Every single question I asked, whenever I used to do it, the only thing I reminded is just keep it simple. Don't overcomplicate things. And that really worked for me for the exam. Now, once you've cleared the exam, and you will meet at various junctions in your life in Australia, there would be lots of tutors, there would be lots of trainers who would probably say, this is difficult, it's not going to be possible. I remember one specific tutor who always used to say, you'll never make it to surgery. And I used to tell, no, I'll make it. So don't go into that path, believe in yourself, and just keep going with what you want to do. Now, there are various ways of doing it. The specialist path, medicine is a bit easier to get in, and also to get out of becoming specialist medical physician is much more easier than becoming a surgeon. Because to become surgeon, you have to get the PR, you have to get permanent residency, you have to clear all the clinical exams and everything. And then only you get on board with, there are specific requirements to work as a surgical registrar. So it's a long run. Becoming a surgeon anywhere in the world, it's long. It's longer comparatively to the physician pathways. So keep that in mind. So you need lots of perseverance, lots of patience. And the way it works is, once you've done your AMCs and all, you got to build up your CV. It's all CV scoring, right? So the way I would suggest all of you guys is, at some point, I know Alan's very helpful in those areas, is to try to start doing some observership after your AMC exams. Try to do some research if possible, affiliate or attach yourselves with some consultants, because majority of the surgeons are very busy everywhere. They're always looking for people who can do some research for themselves, and they'll help. And they're very hungry. If somebody says, I want to do research with you, can you give me some projects? Chase them and they will give you some projects. That research bit is very helpful. So I think research is something which you guys can always look into, because that helps in the surgical pathways. And I think, look, there would always be biases as well. I think the biases run in every country, and it's not, I wouldn't call it anything else more than that, but that's inherent. That's the societal norms. So you just have to cut through those biases by just showing yourself that you're fine. Because often when I used to work, there were times when people used to think, oh, this guy's from here, he must be lazy. And I was like, okay, this is not done. So what works is strong work ethics. You've got to be very professional, very hardworking, and everyone sees that. Everyone sees that. Once you have that, nobody will stop you from there going forward. And I think the communication style is another thing. I think from where I come, we are very verbose. So I had to cut down the way I speak a lot. And so I cut down it to be more concise. So I think communication style is something which all of us can work when we're communicating, because healthcare is all about communication, right? So that is one of the other key criteria which everyone looks in when you're going for interviews or when you're working in a healthcare sector. And I think those are the main things. And I think something like corollary which can always work at points with you is, while you're working, because there's a gap from AMC to getting a job to getting to pathway, this period in between, right? Don't waste it. use it for doing some small community services, teaching, because all those things will count. And especially, I think it's this, firstly, congratulations, you become doctors. It's a highly focused area. So if you want to get to the next step, you need to still be more focused. So you got to utilize your time and ask yourselves, how much have I progressed? What have I done in this month for me to achieve or come to that goal which I want? That you need to ask on a monthly basis. And if you're not ticking the boxes, then you're not reaching. It's a game. It's a league game. So especially, I don't know about the physicians, but surgical pathway is a high stakes, high league game. If you're not there, you won't make it. So that is the only piece of advice I would say. And I think Alan's course is fantastic. I did the MCQs. I don't think I did the clinicals, but I did the mock clinicals with Alan. That helped. This gives you an idea about how you go about it, because back in India, we never had OSCEs. I still sometimes struggle with OSCEs. And it's not about knowledge. It is absolutely not about knowledge. All of you guys have the knowledge. It's just the delivery, how you deliver, what the technique is, how you speak. Within those 5 minutes, what are you going to talk that you convey to the examiner that you're good, you're safe. That's it. That's all what it counts. That's about it, Alan. I think I'll keep it short.
Oh, thank you, Nagendra. No, that's wonderful. And congratulations on you on your fellowship too. That's fantastic.
Thanks a lot.
And thank you for your kind words. Any questions for Dr. Nagendra and Kush?
Thank you, Dr. Nagendra. Yes, there is a doctor. I think he's special. So I'm a consultant physician from India, MD General Medicine with 2 years of experience. Should I go for AMC MCQ or a specialist pathway?
Yeah, okay. So specialist pathway has always been very onerous. Onerous when I say is, Alan, we all know how the system works, and it takes ages for the colleges or surgeons to move and shake something. So these applications take long process, long duration. Now, especially, I don't know much about physician pathway, but the surgeon pathways, they always want a great amount of experience. 2 years of experience probably will not cut it. They would want somebody who has worked as a consultant for at least 8 years, 6 years, 7 years. That's when they start considering things. Now, one pathway they usually do is, if you worked 8 years and you come from a background where you've got enough experience, they will say you're competent. Then they'll put you into some hospital for 2 years under observership with some other consultant, and they're all fine. They'll go through it. Sometimes they may ask you to give the fellowship exam, the FRSAP exam, as an entry exam, and you give the exam and you pass, then you're straight off with that. So there are shorter versions and a longer version as well. But with 2 years experience, I do not think you will cut it. But it's worth contacting the colleges and asking them. They can guide you in that.
I think that's all for Dr. Nagendra. He's traveling as well. I don't want to bother him.
I've got time right now. I've got my flight in another 4 hours, so it's be fine.
Okay. Okay. Rest of the questions are
what Dr. Nagendra was saying. I can tell you my experience a bit about this, but like the specialist pathway is expensive and also it's onerous. But my main emphasis to any of you that want to specialize is to get yourself into the system as soon as possible. Once you're in outside the system, you've got nothing. Inside the system, you've got a chance. And like I always tell this story when orientation that I was at the reception here. A guy came to see me. He was from Iran, and he said, look, I've just come from the College of Pediatrics, which is in Melbourne, and I've had my specialist assessment, which cost him $10,000. And I said, look, I can tell you what they've told you. And he said, oh, what's that? I said, they've told you they'll give you credit for part 1 of your specialization and then get yourself into the training program and you'll be all right. He said, yeah, that's exactly what they've told me. And what they've told him is an impossible dream, because they're just never going to put someone into a specialist training program outside the system when already inside the system it's very, very competitive. So they wouldn't do it. So I said to him, come and do your MCQ. Let's see what happens. So he was a pediatric oncologist. So he did his MCQ with us, and then he passed, and he picked up a job at Box Hill Hospital here in Melbourne. He already had his English because that's the only requirement he needed for his specialisation assessment. So he picked up a job as a pediatric resident at Box Hill Hospital. Now he's a pediatric oncologist at that hospital. I don't know how. He passed his clinical exam, but inside the system, some professorial support saw him and realised what sort of talents he had. Doors opened for him inside the system that would not have opened up for him outside the system. And now he's a pediatric oncologist at that hospital. And I don't know, but they fast-tracked it in some way, and he's very, very happy.
So if I can, I completely agree with Alan. I always tell my peers that once you're in the system, you don't have to do anything. The system will move you. As long as you're working professionally, hard work, strong work ethics, the system will keep moving you. Because what Alan has said, how that pediatric oncologist would have worked is what happens is you're in the system, they see you working on a daily basis. Suddenly they realize, actually, this guy is much more senior. He knows more, he has more knowledge than the rest of my peers here. We should support him. And then they will start asking, what's your plan? Where do you want to go? What do you want to do? And that's how the system actually supports. If you're good enough, they will take you forward. And I think I completely agree with that. And that's why I think it's very important to get your foot in. However quickly, however possible, just get your foot into the system, start working as a doctor somewhere, and suddenly you will see so many doors open.
Good. Thank you, Nagendra.
Thanks a lot.
And have a good trip.
Oh, thank you. Thank you very much. I'm actually heading back tonight, so that's fine.
All right. All right. Lovely to see you, and
Bye.
congratulations.
Yeah, love to see you. Yeah. Thank you a lot. Thank you. Bye.
Thank you, Dr. Nagendra.
Thanks. Thank you.
Okay.
Okay.
Yes, Kush.
I have a few questions here.
For me? Yes, Kush.
So how to come to Australia after clearing part 1 from India? Can you please elaborate on job opportunities, AMC MCQ, particularly in Victoria?
So I
What
can,
are my...
let's do one step at a time. So then from if it happens that you do your preparation and you pass your MCQ in India, that's fine. There's 3 examination centers in India where you can do the MCQ exam. So then you can apply for a job as a resident from India in Australia, anywhere in Australia. And when Kush was saying in Victoria, I wouldn't limit it to that. When you're looking for that job, like the first speaker said to you, Naraj, you need to look widely. The thing is, you need to get yourself into that system. You need to get that job. So I wouldn't be limiting myself to work in Victoria. I'd be looking anywhere, because once you get yourself into the system and you start working, and then, like I said, you become fully registered, then you can pick wherever you want to go. You'll have hospitals chasing you then. You won't be chasing them. So the main thing is to broaden your outlook. Get yourself into anywhere where you can, but there's nothing to stop you from applying for jobs from India into Australia. The only thing is that you probably have passed your MCQ without any sort of preparation. The problem is doing what I said, getting the referees from Australia, getting the making sure that your CV is good, all of those sort of things. But this course that we had last week here, the 7-day, 3 of the doctors in that course who are working got their jobs from their country of origin. They applied and picked up, not only that they got the jobs, the 3 hospitals were sponsoring them as well. So not only did they get a job, they were sponsored. And then when that happens, the hospital assists you with your visa situation as well. But there is no reason, if you've got MCQ in English, that you can apply for jobs in Australia. The only problem is knowing the best way to do it. And that, unfortunately, you get that sort of advice from doing the course.
Alan, this is one of a common question that's being asked by a lot of the doctors. Someone has 2 years of experience, someone has a gap. For example, Dr. Nancy is asking, could you please provide some insight on whether the gap of few years after completing MBBS graduation might have an impact on one's ability to secure a job even after completing the AMC clinical exam?
Okay, the gap.
How?
For me, my experience is the gap is a thing of the past. The gap before COVID, if you had a gap of 4 years, 3 years, 4 years or more, often the advice was, okay, what you need to do now to take away the gap is to go back to your country of origin, work for 3 or 4 months, make sure you've got that documented, and then come back and then you'll find a job. But I'm getting many people, I've got people that have picked up jobs now that have passed their clinical with a 10-year, 11, 12-year gap. Pre-COVID, this would never have happened, but it's happening now. A 2-3 year gap is not a big issue. Of course, if you haven't got a gap, you know, it's better. But, you know, if you're expected to do the AMC examinations, everyone's going to have a gap.
Yeah.
You need some sort of time to help you prepare for these. And also, there were 2 years because of COVID that the exams weren't happening. So, you know, those doctors that are here and they might have a 3 or 4 year gap, 2 of those years you wouldn't have had an opportunity to sit the exam because of COVID anyway. So they can't possibly count that.
And Alan, we've had a number of doctors who've had more than 10 years of gap who have got jobs here.
Yep, now.
So
but
not
I would say if
not
you've got a gap of about 10 years, then, or 8 or 9 years, I would think that you would need to have passed the clinical.
Yes, yeah. So someone asked me, does the AMC exam marks matter like USMLE? I don't think so. It's just the pass of it.
Well, like I think anything, if I'm looking for a job and I've sat my MCQ and I've got a score of 280, 290, I would certainly be putting that in my CV and I would be letting everyone know that I've done very well at the exam. If I've scraped through and I've got 250 or 251 or 2, I wouldn't say I would need to advertise it, but if you've done very well at an exam, I would certainly let people know that I've done very well at that exam. And I would be making, you know, I've put into my CV, I passed that AMC MCQ exam with a score of 320 over whatever it is. I would let them know. And I think it would have influence on whether you get a job or not if you've done very well.
But it doesn't matter like USMLE, Alan. It's just a pass or fail. Yeah. That's all that's being considered on a resume. It just says pass, means pass, that he's done. I saw
a question there, Kush, that someone says, with the courses, well, when would you sit the exam? So I think what we always recommend is that you, of course, with our 6 weeks course, if you feel you're not ready for the exam, you can do it again free of charge. The 12-week course, you can't. You can do it again, but you would have to pay half price again. But what we always say, usually one course is enough. Usually I find if it's not enough, it's usually because there might be some sort of communication skills influences there. But I think that usually I would say that, for example, both those, the 12-week and the 6-week MCQ course, that you would do the course. We always say probably leave 1 month after the course to sit the exam, because the course will throw up some things that you realize that you need to do more study on. And by sitting the exam about 1 month after the course, that will give you enough time to do that preparation. Plus it means that the course is still fresh in your mind as well. So I would say the course, leave a month, then sit the exam. So usually, like, the course is 6 weeks, 1 month. So probably, let's say 3 months preparation for you to be prepared and then sit the exam. And our pass rate is very good. And like I said, you need hard work. We'll give you all the tools you need. You need to put the work in. And I'm not doing it from anecdotal. This is what happens. And our people pass.
Is it possible to get a job with only passing part 1 plus 2 years of experience after MBBS? Also, do ARIMGSAS after taking MCQ course and passing helps us in finding jobs or reviewing a CV? Any sort of recommendations on skills to be developed or for securing a job?
Look, many people are like, getting jobs now with the MCQ, many with MCQ in English and good CV, and then knowing how to prepare to apply for these jobs. And an example is what I told you, our 7-day courses, nearly every doctor in those courses are working and they've only passed MCQ. Nearly, there might be just one or in those courses not working, but nearly in many of those courses, 100% are working.
And the 7-day prepares them for clinical. By 7-day, Alan means there is a preparatory course for clinical that we run. The candidates coming in there have almost all of them are working, and they come down, they take a leave, and then they are preparing for the clinical day. Another question from Nepal, Alan.
Yes.
One was about the exam centers. There is a website, Pearson, where you can have a look on AMC as well. This is a common question being asked as well. That do we have exam centers? So they can go on the website and refer there. But you can send us an email as well. We can help you with all of that. I'm a fresh MBBS graduate from Nepal and have started preparing for AMC MCQ CAT. What are the chances of me getting job after I clear AMC MCQ exam before sitting to the clinical exam? I think you've already answered it.
Yeah.
Do we need research for getting a job in Australia?
If you've done research, it's all of these things are influential in you getting a job. So if you've done research, it's a bonus, of course. The same as if you've done, like Dr. Naraj said, if you've done observership, then it's a bonus as well. There are many hospitals that have official observer programs that you can join, and usually they'll charge you, but you can do it. But if people who do our courses, we've got free observership, as that's just part of it. We've got a surgeon that takes people to do observership, so people can, and we have most of the observerships in the hospital have got limitations on it, like you need to be a permanent resident. With our observership that we have, you don't have to be. People who are not permanent residents can do our observership. But all those things are influential in getting you a job. That's all they are. The same as if you've done a Masters of Public Health or any of those, or a Masters in Hospital Management. All of those things, they're not going to get you the job, but they're influential.
One of the doctors said that what is the possibility to secure a job for those who are 45 years and above? Even I think he would have been trying to say, if 45. They have passed in EMC Part 1.
Yeah, I wish I was 45, but I think it's good. It's 45 is young. So it's not, and if you've got it means that you've got a bit of experience behind you. Depends and it's a little bit easier. Hospital, it might, you're possible, of course, might be a little bit different, but general practice would fit in perfectly.
We have a candidate, he's 60 years old, he's with us doing clinical now.
Look, I've had a candidate that was working in a newsagent as a paper boy, and he'd been working in it from Vietnam. He'd been doing it for 6 years, and he came and did the course, and he passed, and now he's a very successful GP.
Is it better to come on a MPH, that would be Masters of Public Health course, and prepare for AMC Part 2 simultaneously, or better to come on visitor visa and prepare for course and AMC Part 2 exam?
Both are appropriate. You can do either one. The thing is, if you're doing the Masters of Public Health, it's usually, we have a number of students that have done that, and then they'll come and do the course in their holidays or whatever they'll do. And we've got many that have gone on and they're working, but it's expensive for you too. Depends what your financial situation is. If you can, well then if you're doing a Masters of Public Health, it's like you're an international student, so it's pretty expensive. And you can do that. Of course, it's good and you can do it, but you don't need to. You can come as a visitor's visa and you can do the same thing.
You offer any assistance with obtaining observership after AMC clinical prep courses? How about the referee?
We advise you about observership, whether you've done clinical or not. If you've just done one of our courses, we'll advise you about where to go for observership if that's what you want.
Can we sit immediately in the exam after completing AMC MCQ course, or we will need some time for preparation?
No, like I told you, what ideally, people ask me this all the time. I've had people sit the exam halfway through a course and pass.
Yeah.
But my experience is ideally, you do the course, you wait for a month, you sit the exam. That's the ideal preparation for it. But of course, there are many, many variables. It could be your financial situation. You might have kids. You might have, you know, wife, husband, whatever. It might have an influence on all of that. So, but the ideal situation is what I just said.
Hi, after part 1, I got a GP offer for pesky, but I could not get through. I'm thinking whether to redo the pesky, directly apply for hospital job. Could you please enlighten me on or about the two pathways?
Many questions I'd like to ask you there is, which pesky did you do? There are 3 peskies you can do. You can do the RACGP pesky, you can do the ACRIM pesky, or you can do the IME pesky. And then you need to be well prepared, and each one needs some sort of special preparation because they're different. They're conducted differently by each provider. So, and we run a course that prepares you for the pesky exam. I don't know whether that person did our course or not, but I would need a little bit more information about that. But of course, I would be, if you've got the job offer, then, you know, I would be, and the clinic's prepared to give you the job offer again, I would try and sit the pesky as soon as possible again. But I would make sure I'm well prepared for it. And from me, I've found that most overseas doctors now are sitting the IME pesky, that they're finding it a bit easier than the other peskies.
Alan, so I would like to ask all of them if there are any other questions in regards to the course. So the tutor was here, Nikhil. He wanted to, if any other questions that you have in regards to the course, in regards to the topic, in regards to cluster, in regards to MCQs, anything that you'd like to ask, that how do we teach or what's the pattern, any questions that you'd like to ask. Otherwise, the tutor might leave.
We got Dr. Beniti in yet, Kush?
No, I think, Nikhil, we're good to go. I'll be able to answer if they are. How could I enroll? I'll let them know about how they can enroll.
You're fine. Thank you very much, Nikhil.
Thank you,
Thanks so much,
Nikhil.
Alan. Thank you, Kush. Thank you, Alan.
All right, thank you.
Good luck for it. Bye.
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 Thank
Puneet.
you.
No, Alan, Puneet is not joined till now.
Okay. Any other?
So there was a question. I'm from Pakistan. I did my MBBS in 2022, then did internship for 1 year. Now I'm currently not getting a job, and there is a gap of 3 months since I completed my internship. What is the advice for me? Should I go get a job ASAP, or is it okay if I prepare for part 1 and after clearing it, apply for jobs in Australia? Or is it necessary to get clinical experience side by side in my hometown? I want to pursue gynae and OBG. Please guide me. What should I do from now onwards to finally secure a job as RMO?
Kush?
She's recently passed in 2022 and just completed internship.
So like what we've mentioned before, your pathway would be to get through the MCQ, get your English, try and get a job. If you can't, I had someone come and see me today, and he's someone who's done the MCQ and he's looking for a job and he's passed English. So I've told him that my advice is to keep looking for a job, but if he can afford it, to do the clinical course as well, because I always believe you never shut a door unless you have to. So by doing that, even if he got a job offer tomorrow, it would probably be 6 months before his registration came through anyway. So while he's looking for a job, I would say that if I could afford it, I would be doing the clinical course, so I can add the clinical course into my CV, make my CV a lot more relevant for people that are wanting to employ me, because if you've done a clinical course, of course, the hospital's more likely to employ you if you've done a clinical preparation program as well, as not only just the MCQ. But I would be doing as much as possible, and then my main aim would be to get myself into the workforce as soon as possible. So if you've got a bit of experience behind you, it's better. I think Kush was saying that the doctor had about 3 months experience, I think.
She said that she has a gap. Let me just check. Yeah, she said that there is a gap of 3 months since I completed internship, not 3 months experience. So she did her.
She's just fresh graduate, 3 months gap. Yeah, I think you would need to do the clinical course. You would need to pass MCQ and clinical, then it wouldn't matter. The gap is irrelevant.
Yeah. I did my MC once and only got 239. Planning to do MSc PUB Health and migrate to Aussie and later to AMC again. Do you recommend that way?
Oh, that's a good. But where's she from?
Dr. Sassini, where are you from? Sorry. Sri Lanka.
Okay. So did she do the course?
I don't think so.
So Dr. Sassini, I would stay in Sri Lanka, keep working. I would do the after hours 12 weeks course so you can keep working. We can adjust times and whatever. And then I would sit the exam and get yourself, because I don't know whether you know Dr. Sassini, but there is it's a little bit easier to immigrate from Sri Lanka to Australia at the moment. So I'm finding that any 7-day course that we have, it's always got 2 or 3 Sri Lankan doctors in it who have picked up jobs from Sri Lanka, because it's easier for the hospitals to get registration because of the situation there in Sri Lanka. And I think there is also some financial incentives for hospitals to employ doctors from Sri Lanka as well. So I think that your main thing is to get you, even you got 239, which is not bad. It's not a disaster. But I think if you've got the time to do the course and keep working, for sure you'll pass next time.
So, which is the best masters in clinical in Australia? And someone was asking about the WBA, the workplace assessment.
Most of the overseas doctors, they'll do the Masters of Public Health. Some will do Masters of Public Hospital Administration, but that's most of them. I find that they end up in doing Masters of Public Health, and again, that's only and most of the ones I know that are doing it, they're doing it because to get here. It's not going to guarantee you a job, but again, it's just influential.
I think, Helen, he meant specialization, because after that he's written like surgery, gynae, derma.
Okay. Well, probably from my experience, the best specialization is psychiatry. I find that they'll find that to get into it is one of the best ones to get into, and one of the ones that many overseas doctors end up going in.
I graduated in 2021 in Russia. Haven't done internship.
You need to look, you can come here and do your internship if you can get it. But internship's very difficult to get. So my recommendation would be stay in Russia, get your internship out of the way, then think about what you're going to do to get here. Because you're a lot more chance of getting a residence job, it's a HMO2 or a PGY2, than what it is in getting an internship. I mean, you can get internships, but they're not that easy to get to. The priority is they give them to local students, and usually if there might be the odd vacancy here and there, but the problem with internship is to know where the vacancy is.
Alan, his question continued that she lives in Australia with a PR. Can I sit for AMC Part 1 exam? Definitely, we've had a lot of doctors who didn't have internship, those who've got it, and they've sat Part 1. Yeah,
you can sit Part 1 without your internship. No problem at all.
She should do Part 1 and Part 2 as long as the degree is valid. It says it's MBBS without internship.
What's the question, Kush?
So the question was, can she sit in AMC Part 1? She's in Australia. She's a PR here.
She hasn't done her internship.
No.
No, yes, she can sit it. And then we can advise you about what's the best places to try and get an internship, which is difficult. I'm not, pretending it's easy. It is difficult, but we've got many doctors that have gone on and done their internship, but it's hard. It's not, you need a lot of advice. but you can do the AMC exams with just your medical degree and without an internship. That's not a drama.
A lot of questions about, can you please elaborate about WBA, the work-based assessment, or AMC Part 2?
Okay, so the workplace assessment is that was set up for as an alternative to doing the clinical exam. So when it was first set up, it was free, and there are a number of hospitals that are involved in the program, and you can go to the AMC website and you can find out which hospitals they are in each state. But it was a bit slow being implemented, the program, and a lot of it was because doctors in hospitals are already busy, and they were asking these doctors to supervise people, which they were objecting to. So now it used to be free, but it's now many of the hospitals charge. So, and it can be as much as up to $10,000 now, but that doesn't matter because you start working and they take that out of your wages. But the problem is getting it. It was supposed to be for hospital, for people as an alternative to sit the clinical. But for example, there used to be 2 in Victoria, the state that we're in. One was at Shepparton Hospital, and one was at Monash. Yes.
If you can see the screen, can you see my screen? I'm sharing all of the
hospitals. Yeah. So in Victoria, there was only 2. And there's Latrobe Regional, and Monash Medical Centre was another one. So Monash will only take people in the WBO program that have got some local experience anyway. So, which sort of defeats the purpose of the workplace assessment program. But many of the other hospitals in other states take people without that local experience. But again, it's very competitive. And you have to apply like getting a job. But if you get yourself into the workplace assessment program, you're almost guaranteed that you're going to pass through without having to do the clinical course. It's like, the best example I can give, it's like me. When I'm teaching at Melbourne Uni, if there was a medical student that was having some issues, having some problems, all the support mechanisms came out around the place to help them to get through, because it was in the interest of the hospital and the university to get them through. And I'm sure it's the same in your country. The same with workplace assessment. If you're doing your workplace assessment and there are some issues that need to be worked on, the support mechanisms will come out to support you through it. But that's because you're in the hospital system. Again, outside the hospital system, like I said, if you're an overseas doctor and you're going these exams and you're having some issues about passing one exam, you're on your own, unless you've got someone like us to help you. But in a workplace assessment, if you're struggling during that, they will help you to get through it, because it's in their own interest to get you through it. That's the beauty of the workplace assessment. But they're not easy to get either. They're very competitive. Many of the hospitals I know have got 40, 50 doctors on the waiting list to get into the workplace assessment programs.
A lot of questions about, is it better to sit the AMC clinical exam online or face-to-face? Is it worse if we sit offline?
Well, I think
what would you recommend?
There's only a couple of exams this year left, face-to-face. And then from the beginning of next year, all the exams are going online, because the AMC leases run out in the place where the centre where they run the exams. So they're building their own centre here in Melbourne. And that looks like it won't be open until probably September next year. So then there's no guarantee either, but that's when they'll start the face-to-face exams again. But up until then, the only possibility will be to sit the clinical exam online. So it's really up to you. And if you're wanting to sit it face-to-face, unless you've got an exam at one of the face-to-face exams this year, you're going to have to wait till at least September next year to be able to sit on the face-to-face clinical exam.
Any more questions? So what's the possibility to secure a job at the age of 45 with AMC Part 1?
Yeah, of course it's possible. And it depends. What is it, GP or hospital?
Even 45 is not I mean, we've had doctors with 60, and it's not unusual. We have in every group, I think, more than that, Alan.
Yeah.
So
45 is young.
yeah, 45 is really young. Would doing observership, getting experience in OBGYN in home country, Pakistan, private tertiary care hospital, not teaching in hospital, be counted in experience to help get a job in relevant field after AMC Part 1?
I think it would be. I mean, as long as you've got the registration that you can prove, everything needs to be proved by documentation. So if you've got that experience in Pakistan, you've worked in obs and gynae, as long as you needed the registration and you've got some sort of paperwork to prove that that's what you were doing, I think it can be helpful for you. Yeah. And obs and gynae is an excellent specialization to have here. Many doctors are picking up jobs with the MCQ. If they've got an obs and gynae background, that they'll get a residence obs and gynae job in the maternity hospitals. And then, like I said, then it's up to you. Once you get into the system and you've got an obs and gynae background, doors can open up for you inside the system and otherwise don't open up for you.
Also, please elaborate, what kind of courses should I do in OBGYN while staying in Pakistan, as I have to take Part 1 yet, and after that I'll be applying for jobs? Still continues the question. After AMC Part 1, should I go for clinical first or better focus on building experience and applying for jobs?
You do both. Well, you don't stop one thing or another. So in Pakistan, I would be working, doing my obs, and then if you sounds like you want to do, you're doing your specialization in obs and gynae, I would keep doing that. But once you've passed your AMC Part 1 and you've got your English, apply for jobs here from there and see what you can pick up. If you can pick up a residence job in obs and gynae, then come here. Then not only that, they'll be sponsoring you probably, and they'll be supporting you with your visa as well.
Which English test is accepted after AMC Part 1 for getting job?
All of them, OET, IELTS, PTE, TOEFL, all of those. Yeah. Most of the doctors are doing PTE now. It's cheaper and they're happening all the time.
I get this question as well, Alan, a lot of times when I'm picking few calls. They ask me, is there a score of 7 each or 7 something like that? Would you like to give some information about that too?
I don't have that much to do with the English, but it's got to be 7 across all.
No, Alan, it's not 7 each, but there's no such requirement. It's just a minimum.
6.5. There was one here today that was showing me, and he got a 7, 8, and 9, and he got 6.3 in writing. So that he has to do it again. Because it's not an average of 6.5 across the whole lot. So he's 0.2 under one of the. So he had to do that was PTE, Kush. So he has to do his PTE again.
Okay. How long does it take to join a specialist in Australia? Since we apply directly for residency program in US, how long will it take in Australia for me to be in that specialty I want to join in?
So you would need looking to come in on a specialist pathway, or what are they looking to do?
How long does it take to join a specialty in Australia? Since we apply directly for residency program in US, how long it will take in Australia for me?
Once you are fully registered in Australia, every year they'll say, okay, if you're an overseas doctor or you're a local graduate, whatever, every year, as long as you're fully registered, every year they'll say, okay, who wants to specialize? Who wants to be an obstetrician gynecologist? Who wants to be a surgeon, whatever? Then you apply to get into the training program. Then if you're working in the system, you'll have some sort of support to get you into those training programs, like some professorial support to recommend you. And then it's up to you whether you get into the training program. So you can get into it the first time. It might take a couple of years, 2 or 3 years, but you'll need to keep applying until you're accepted into the training program. So it'll be virtually up to you. But the only requirement is that you're fully registered. Once you're fully registered, then you're eligible to join any specialist pathway, the same as any student, any doctor in Australia.
What time of the year major recruitment drives happen?
this time of the year. They're all sorting out their rosters for next year. So any time from now right up until November is a perfect time to be looking for a job.
Someone asked me about this as well. Does it impact the number of times we sit the exam? If someone fails it in the first attempt, do it impact in the next attempt? Heard a lot from people that once we fail, we cannot pass it again. Is it?
That's not
No,
true.
yeah.
They're not. If it was found that they were looking at your previous attempts, it's discrimination, and it just wouldn't happen. Otherwise, they'd be in trouble themselves.
No, that's not at all true. We have candidates sitting with us the first time and they've passed the second time. So it's nothing like that. We have a huge database about that. That's not true, definitely.
Just
good morning.
Keep talking, Kush, and I'll ring Dr.
Sure.
Puneet and see if he's coming in.
Yes, okay. So don't know whether it's the right time or platform of this question. I've been trying to learn about neurology as part of RACP advanced training. I'd like to know about further subspecialty neurology. After the advanced training, is there subspecialty training like neuro or ophthalmology or headache medicine, epilepsy, etc. in Australia? I'll keep speaking, okay. I can give them more information about our courses. So doctors, if you have any queries about what and how and what sort of courses we run, I'd like to introduce myself. I'm the office manager at Alan Roberts. So Alan has 40 years of experience, I think more than 40, and I've been with him for 8 years now, training a lot of IMGs, not hundreds, I think thousands and even more than thousands. We run these courses back to back throughout the year. And we don't have any holidays, so we are running it 9 to 9. The public holidays are the only days when the staff is off, but the courses are still running. We try to cater them as much as we can and comfort them as much as it is for the betterment of the candidates when they have the best time to do these courses. We get a lot of calls that we are working full-time as well and we want to join these courses as well. What are the best options? What will happen? Will the recordings be given to us or something like that? So for the part 1, that's what we are focusing on today, that is MCQ. There's a 6-week course that we are doing. So it is 9 to 5. If you're in India or in other parts of the world, if there is a time zone difference, you'll be able to do some part of it in the first course. And if you've missed something, you can do it in the next one. That's another free repeat that you'll get. You'll have access to a WhatsApp group that we make. We make a WhatsApp group in which we add all of you together. So you'll all be sailing in the same boat, which will be a lot of support for you all, because I do pick a lot of calls and there's just always uncertainty and anxiety, about what is going to happen because it's all new and you're investing a lot of money in it. We all understand that and we've been doing that for long now. We have a lot of word to mouth as well because he's been doing it for 40 years. You'll have a WhatsApp group where if you'll even miss something, there'll be colleagues, there'll be friends of yours, you'll make friends and they'll be sharing all of those details with you. If you've missed something, a lot of people make written notes as well and they share all of that in the WhatsApp. You'll also have access to your own student portal. You'll log in, you'll have your email address and all of that for 1 year or until you don't pass. For 1 year or 6 months, we give you this access to the course notes. You'll be able to go back and refer to that. So once you've completed 6 weeks, you'll be able to revise everything. I do get this question a lot that how should we prepare without the course or what books should we refer? There's a lot of material outside. I won't recommend. You'll be paying anyways a fee to, attempt this exam. I've seen a lot of people pouring a lot of money doing this exam again and again. It's better to go prepared first. So you prepare in a proper way. We have a platform which prepares you. You prepare and then sit for the exam. At least after you've done this 6 weeks, there are 6 trial exams. Every week there is an exam. So first week you've joined the course, we've done some course, we've discussed a cluster and the tutors display a MCQ. They say, okay, let's talk about this, guys. And then the candidates start answering. If there are 5 choices, they start giving their answers. I think it's A, B, C, or D. All the candidates are answering. Then the tutor says, guys, this was the correct answer. And then the students can say that we thought this would have been the answer. So the tutor would come back again and he would say, this won't be the answer because this is the reason. So it's a complete interactive course. We can easily do them recorded and put them up, and we can all give you all references. Okay, you can refer to this guideline or that. No, for us, it's the students that we really want to cater, and we want them to be satisfied 100% with the interaction that that they need. So that's why we make it interactive, and the tutors are always present 9 to 5, discussing each and every topic in detail, every MCQ that they think is relevant to have that base strong. I do get a lot of queries on the phone when they say, I have 10 years of gap, I have 19 years of gap, or I'm just a fresh graduate. So for us in the course, all of you are equal, even if that's a person who's a recent graduate or someone who has 10 years of experience. We clarify all of your doubts. We try to make a basic clear for you so that you have enough of knowledge. If there are questions changing, because it's a computer adaptive exam, when you sit, if there are 4 of the people sitting in the same exam, the exam would be different for everyone. If, for example, if I'm sitting and I'm good in OBGYN, I've answered one answer correctly, there'll be another level for the same OBGYN subject. They'll try to test me through OBGYN. Okay, it looks like that she's good in this subject, and they'll keep making it a bit harder. And once I've done all the OBGYN correctly, okay, then they'll come to another subject. If Alan has been sitting that exam and they've asked him first OBGYN, he's not answered it correctly, okay, they'll say, let's test him in another field, okay, medicine. Now let's check in the surgery. So in that way, it's a computer adaptive exam. Always Alan says this, when we have candidates, they come out of the exam and they tell us that, I think it was quite easy. Then Alan is thinking, okay, let's see what the result is going to be. If they say that it was a really tough exam, and that is where we think, okay, that the student, would be able to go ahead or he'll pass. But this is how it is. We exactly know, we've been doing it for long. Now, there was always a question about 6 weeks and 12 weeks difference. So the 6 week runs 9 to 5. That's a morning course. We've always been asked, we need a course. We are working full time. What would you recommend us to join? That is when we came up with a new course that was after hours, not new. It's been more than 5 to 6 years for that one as well. So that's 9 to 5. There is no free repeat for the after hours. There's a free repeat for the 6 weeks though. So the 6 weeks run 6 days a week, and there is an exam every week. 1 week finishes, there's an exam. You get a feedback for that. The tutor comes in and tells you that these were the 120 questions you've answered. These were the answers for that. Why was this answer for that question? So 6 exams in it, whereas in the 12 weeks, there are 4 mini trial exams only, lesser questions. But we've organized both the courses in a way that they should prepare you properly for sitting your AMC MCQ exam. The tutors are the same, the knowledge is the same. They know how to shorten it a bit in lesser hours, because as you can see, there are lesser hours in that one. So the tutors are the same. They know how to, portray that in that mode of 12 weeks. How to manage a class if we work here in India. We have a lot of doctors from India attending these courses, doctors. So that's what I said. Either you take a leave or, because if you enroll in a 6 weeks, if you're in India, the course will start at 4 in the morning. You'll be able to do half of it there, and half of it you'll have to squeeze it. If you miss something, you'll be able to get the course material. You'll have friends there. We'll make a WhatsApp group, and you have a free repeat. If you miss something in the first one, you'll be able to cover it in the next one. When will the 6 weeks course start? I would like to join. We have all the dates. I've scheduled all the dates for 2024, entire 2024, but we have a course starting Monday as well on 2nd of October. We had a lot of queries. That's why we thought of coming up, doing this seminar so that we can answer all of the questions together. Do we get a professional license after we pass? Yes, you get limited registration. You're applicable to apply for jobs after AMC Part 1 and English. You'll need English as well. What are the timings for the 12 weeks? So it's 7 to 9, Monday, Tuesday, Thursday, Friday, and on Sunday, 5 hours. Do you provide notes with the course? Do we have recordings after the class? We do provide notes. You'll have access to your own student portal where you'll be able to access all the course material that you need to refer, the slides, the topic that was discussed today. We don't provide recordings. That's why we've made a free repeat for the 6 weeks one. For April and March.
The reason we don't supply recordings is because we discuss very relevant stuff as preparation for this exam. So if we supply recordings, then we don't know where it's going. So yeah.
Regarding the online course, sorry.
No, go on, please.
Regarding the online course preparation classes, there's a specific time of the year when the AMC clinical course commences, and can interest participants enroll at any time by contacting. Yes, doctors. As I said, I'll repeat again, all of our 6 weeks MCQ preparatory courses, all of our clinical courses, we run them throughout the year back to back. And you can enroll, even if you've decided to enroll in the middle of the course, we can help you in that as well. We are able to cater all of your needs that you have. We are approachable. The only thing you have to do is approach us, send us an email. We will figure out the ways to help you. So you can send us an email at admin@arimgsas.com.au, with which if you'll discuss a problem only, then we'll be able to sort it and solve it and give you a solution. We are quite approachable. Feel free to ask us the questions. Is
So,
AMC hand?
At the end of this seminar, we're going to be sending, thanking everyone for attending. And we're also going to be sending them a link where they can access any of our courses, or they can ask any questions they want to, even after this seminar is finished, and we'll answer them.
Yes, I'll write down the email address written here as well. Is the AMC Handbook of Multiple Choice Question John Murtagh sufficient for preparation?
Yeah, look, if you go to the AMC website, you'll see 100 books there. And I think probably you know better than me that this medicine's very large and huge area to study with. What you need really, if you've got MRTA, the main books that you need to do for preparation for if you're going to do the MCQ is MRTA. You need the AMC Clinical Handbook, and there's the purple book, the annotated questions, 800 questions. They're the main 3 books. If you wanted to, this is for the MCQ exam. The hospital guidelines are very useful because it's very up-to-date material, but also then you need access to other material that you'll get all the information about when you do the courses. And that means, you know, which recall material is useful and which ones are not. There are many recall material out there, and the AMC knows about it, and some of them are absolutely useless. And some of them can be an impediment to you passing the exam because you're being told the wrong stuff. So you need proper guidance in which is the best material to use. But for the main thing, that the AMC Blue Book, which you can't buy anymore, but you can get it off us, because the AMC is not selling it anymore, but you definitely, even though it's old, you still need it. It's a very useful book, and still some questions come in the exam from that book. You need MRTA, and you need the annotated 800 question book. That's it. If you want to buy an extra book, you buy the clinical book, the AMC Handbook of Clinical, which they don't sell anymore, but you can, if you contact us, we can get it to you. Because the reason I'm telling you that is because the pictures from that book come in the MCQ exam. Okay, they used to come from the anthology book, which is a waste of time now. So you need if you want to buy an extra book, you buy the clinical book. That's it. Otherwise, if you're talking about Bailey and Love and Davidson and all that, forget about it. I think they're impediments to the exam.
In regards to the installments and fee, I'd like to tell this to a lot of candidates here as well. Guys, please join us and follow us on YouTube, Facebook, Instagram. We do have some offers at times that we can offer, and we do put that up only when you're members with us, or you're following us, or you're leaving good reviews for us on Facebook and Instagram, although we have all of those reviews already because we've been doing it more than 40 years now. In regards to the fee, if you can't pay the whole thing all together, send us an email. Definitely, you can just do a deposit first, $1,000, and then we can put you on a payment plan. Then you can let us know within the first 3 weeks or 2 weeks, when will you be able to wind up that fee. We do understand. And if a doctor who has done a course with us can refer you, if he sends us an email, we can give you a 5% discount for that. So you're most welcome to send us emails about this, but you can do $1,000 deposit first, with which your enrollment will be ensured. And then the sooner the better. If you do enrollment a week prior, it's good. Friday tomorrow would be a public holiday, but don't forget to send us emails. We'll get back to you on Saturdays and Sunday. So we have a course starting on Monday. If you're interested for that, you can go on the website now, pay a deposit of $1,000, and then we can talk about the installments during the first 2 weeks. Yes, you can surely go in installments. We do charge admin fee for going on installments, but we waive it off if you paid the fee on the day that you decided. Is it preferable to join the course after an initial self-prep, or should we use it at the start of our AMC prep as I'm practicing? As Dr. Nikhil said that, and all of our candidates say to us, it's always good to do the course because the course will guide you exactly in the direction that you need to go and what to prepare. There's a lot of material out in the market which is guiding you 100 different ways, but we've been experienced. We have experienced tutors with us who's been teaching for so many years now. They'll guide you exactly what you need. I would recommend do the course first. You'll have a broad prospectum. You'll have candidates sitting with you who are sailing in the same boat, preparing for the same thing. They'll share those things with you, and you'll be able to go in the right direction, and Alan will be able to guide you.
And not only preparation for the exam, a big thing now is that it's going to help you get a job as well. So it's not only of course, it'll help you prepare. You're going to be spending money on preparation for the course, so it'll help you with that, but it'll help you with the job just as much. And so if it happens that you pick up a job because of it, then it's very, very good money, well invested. Okay.
We're getting all of this question about the difference in the 6-week and 12-week. I'll elaborate. And Alan is the director. The teachers are the one he used to teach with us. He used to do a lot of communication classes, which he does now and then still. But it's a lot being done by our tutors who already passed it and who's been teaching for long with us now. So there are a lot of different faculty who are special in their own subjects.
Most of the doctors that we use, nearly all the doctors, are all overseas doctors. It's because, like you know, I told you I worked at Melbourne University too in the medical field. But the thing is that sometimes I used to bring tutors from Melbourne Uni that are teaching the undergraduates. And many times the students would come out and say, "What are you doing to us, Alan? You know, we understand you're all doctors. You're not undergraduates. You're not getting undergraduate. What you'll do in our course, everything you do in our course is preparing you for a specific exam." So that's why we use those tutors, because they're all tutors that have already passed the exam. So they know which areas to concentrate, which areas not to worry about. So everything in this course will be worked towards you preparing the exam. So that's the reason why we do it. And we find we don't want people to be conducting tutorials in the course that don't know what this exam's about. So this is a specific exam for a specific amount of people. And so we want doctors that know what it's all about so they can prepare you in the best way possible to give you the best chance possible to pass this exam, because that's what you want. Because you don't want to be sitting this exam, then failing, and then having to pay for the exam fee, which is expensive as well, and sit that again. You want to sit this exam and you want to pass for the first time.
I'm getting a lot of questions in regards to the difference between the 6 weeks and the 12 weeks.
Right, the 6 weeks, well, the amount of hours, the 6 weeks, even though it's 6 weeks, it's pretty much full-time, 6 days a week. So there's a lot more hours that you'll get in the 6 weeks course than what you'll get in the 12-week course. The 12-week course, but both courses will prepare you very well for the exam. But the best way that I can explain it is in the 6 weeks course, you'll be prepared for everything. In the 12-week course, you'll be prepared for all the important things. Okay, that's the best way. And in the 6 weeks one, you'll get more trial exams than you get in the 12-week one. 12-week one, you'll have 3 mini trial exams, but in the major 6 weeks course, you'll get 2 major trial exams, one at the beginning, one at the end with feedback, and every other week you'll have a trial exam as well, a smaller trial exam. So you'll get access to a lot more trial exam practice examinations in the 6 weeks as against the 12 weeks. As Kush said, the 12-week one we set up to help people that might already be working or finding it difficult to attend a course during the daytime. That's the main. But both courses, you'll be very well prepared for the exam.
With the mock exams, Doctor, so we have the updated ones in our courses. We want to have that quality being maintained for our candidates. So they get a lot more exposure than someone just doing it independently. It's not only the mock exam, they do get a elaborative feedback for why did you think. The candidate would say, I think this would have been an answer, because out of the 5 choices, you get confused in the 2, and this is where the elaboration comes. So they get that elaborative answers.
Yeah.
Dr. Moise Kalele, do you want to mute yourself, please?
Yes, you can. You get online classes for the clinical as well. So it's up to you whether you want to do it. We're running 2 courses at the moment. So there might be some people in the class, and most of the people will be online, but the same course will be conducted. So it's really up to you. Some people, the exam will be online, or at the moment there's still a few exams that are being face-to-face, but some people might be doing the exam online, but they still prefer to come in because they find it maybe difficult at home to study because of kids or whatever. So they want the environment where it's more conducive to study. So there might be many reasons why people want to come into a class, but essentially at the moment, we have more people online than we have that are coming in.
Because, Doctor, the next year exams will be all online. So we quite adjust ourselves straight away. Before even any announcements being out there, we prepare ourselves and we update ourselves. This is what we've been known for throughout the years doing these courses. When there were online exams, we had online mock exams. So we quite keep us up to date for the doctors to have that basic knowledge, which could, it's the basics that as other doctors, the special doctors who came, they said that it's the basic knowledge that you need, a strong base, so that which you can convert, or whenever if there is a change in the exam, if it's online face-to-face, we clear your basics here, the basic knowledge. Even if it's being changed to online face-to-face, you'll be able to answer. Whatever the changes come, whatever you'll have to go ahead and answer, you'll be able to when you have a basic knowledge. That's a strong base that you need. But yes, we've changed. We know that the physical examination would be online. We'll be doing our courses that would cater only the physical examination needs for online workshop. So we've adapted ourselves quite well for that, and we keep ourselves quite up to date.
Which I think we should wrap it up now.
Yes, yeah.
Yeah. So we'll be sending a link, and be an opportunity if anyone wants to ask any more questions.
Yeah.
Yeah.
They can send us an email as well at admin@arimgsas.com.au and follow us on Facebook, Instagram, Twitter, Facebook, and we even have it in Telegram if they want to follow us. So you can join our Telegram group too. We update everything, any offers that we have at times, any workshops that are really good to add in your resume. There was someone who was asking what could add on. So in our courses like MCQ, we have a workshop included in it, that is the ECG workshop, which is accredited by RACGP, which gives you CPD points, continuous progressive development points, which is a good add-on for your resume. So if you join a 6-week course, you get that workshop included in it. That would be a good part for your resume, which gives you Australian exposure to the Australian healthcare medical system. That's why, so our clinical courses as well have all the workshops included, which is a good add-on for a resume. I just read one question. That's why I wanted to answer that, Alan.
It's women's health. We also have
physical
examination, which has got CPD points. We have advanced life support, basic life support, all got CPD points.
Yeah.
We've got IV cannulation, which has got CPD points. And
Someone was asking me that what could strengthen the resume. So these are all the workshops, except ALS and BLS, a lot of workshops are included in the course. So if you do the course, you get those, which could be a good add-on for your resume that gives you CPD points accredited by RACGP. All of them are being accredited. We've been up to date with the accreditation with the Terrenium 2022 to 2024. Yeah.
And for example, the reason why we do IV cannulation is even though we get lots of doctors coming now, all our IV cannulation workshops are full because people are using intravenous things in their clinics and whatever. And so they'll either practice nurses or doctors will come along and they'll do the workshop. But the initial reason why I set up this IV cannulation workshop is because one of the doctors I know went for a job interview and the HMO manager took her straight up to the wards and he said, put a line in this patient. And she did put the line in the patient. That was the job interview. So we thought we'd run this sort of workshop that can help you, enhance you also in finding a job and also a skill that you'll need when you're doing your job as well.
Yeah, that's one of the things Alan knows as well. A lot of people get interviews, they inform Alan because he was the referee for them. So they do call him back that, okay, there was opening in this hospital and I got a job interview and he could guide them, or we have people who can guide them that, okay, this is how you should present, or this is how you should be presenting. In this way, we do get, there are openings there and we can guide other doctors as well. He does get a lot of calls from GPs. He's trained people 40 years before who have their own 50 to 100 clinics as well, who own their clinics, and they always look for doctors, which they ask us to send resumes, and we do forward their resumes who've done courses with us. So there is where Alan also is helpful as well. His courses are helpful in that way as well.
Like Dr. Naraj.
Yeah.
I didn't realize he employs 200 doctors.
Yeah, yeah. So that's one of the aspects as well for the job, through which Alan always knows where are the openings or where people should apply. The people who do courses with us, they do contact Alan and he gives them a list of, probably the hospitals nearby or where they can apply or ways how they can apply. So all of those are the services which he doesn't really charge extra, but he does guide them. So it's just as if holding your hand from
even
Epic
with the AMC, Kush, even with the AMC. So we've got good connections with the AMC. So if there's any issues with the AMC, usually we can assist with that. For example, I've been to Canberra and in-serviced the AMC staff about what bridging courses they've done. And so we've had a long term, and we're one of the few organisations that's got our bridging courses on the AMC website as well.
Okay, I think you
All
want
right.
to wind up.
Thank you very much, doctors, and thank you, Kush, and thank you to all the doctors that came in and talked, and thank you to all you people. I hope we can help you, and if you need our support, we're here for you. And whether you do one of our courses or not, thank you for attending today. It was very nice. Thank you.
Thank you.
Thanks for organising it, Kush.
Thank you.
Bye.
Bye.
Bye, everyone.
Right.